Good morning. So my name is Rainer. I am the treasurer with the Society of Behavioural Health Singapore. I'm also finishing up my PhD at the Saucy Hot School of Public Health in epidemiology. So it brings me, a great privilege and great pleasure to introduce our speaker for this morning, who will share with us for our final part of our webinar series on COVID-19. So we've got Dr. Mathia Lee here. Dr. Mathia Lee serves as Assistant Director for Integrated Health Promotion at the MOH Office for Healthcare Transformation, or the MOHT. Their goal is to work with communities to help shift community norms towards a conscious emphasis on health, leading to long-term and sustained behavioral change. Prior to her current role, Dr. Mathia headed the data and design team at the Health Promotion Board, working on campaigns like the National Steps Challenge. So, I won't belabor any points here. I'll pass the time on to Dr. Mathia, who will be sharing with us a little bit more on our theme for today, which is catalyzing community action in times of COVID-19. Dr. Mathia, please.
Thank you so much, Rainer. It's really an honor and privilege to be invited to have this chance that MOHT can be sharing on this topic. This topic is a really important one, community action, because community action, especially in times like these crisis situations, the first response really usually comes from the community as the trusted resources that people actually know and understand. A lot of these community leaders, the community members themselves, understand their needs best, understand what works best, and there are a lot of resources that can actually be put together and tapped on because of the community action. So because of this, I think we are really glad to be part of this effort that the Society has organized, this webinar series. So really thank you so much. This 15-minute webinar, a very short one, is intended for any members of the public who might be interested or who might be quite experienced at organizing for the community, whether or not you're part of an organization, a non-profit, or whether as an individual yourself. So hopefully some of these tips and sharing will be helpful for you. So in today's talk, I'll be sharing on 4 main areas. It wouldn't be really very comprehensive. This is not a comprehensive module on how to organize, but more really just some tips and considerations that we ourselves have learned. So we're not really experts, but people who have perhaps in the last year or so been working or learning to work with communities and sharing some of our learnings here, our experiences here. And I think more importantly, I understand that many of you viewers are also experienced community organizers. And I also like to actually invite you to maybe share your experiences, your learnings, what your thoughts are, perhaps in the comments of the YouTube video that will be posted up, or perhaps in the chat that we can discuss a bit later. So hopefully this can be a co-learning session. I've divided my talk into 4 main areas. I think the first 3 are what people are very, very familiar with, figuring out what to do in terms of the community initiatives or community action, who can actually do it, and figuring out how to do it. But the last point is usually what people tend to forget, and it's so important in times of COVID like this, when the situation is moving so quickly, so unpredictably, with a lot of uncertainty, figuring out when to actually stop. So I'll be starting on my first point, figuring out what to do. When we try to figure out what to do, especially in times like COVID, we tend to just go in with what we are most excited about, what we feel most passionate about. We tend to be quite reactive. But a lot of times, it's good to still remember the very fundamental principles of community organization. Most community organization projects would start with a good needs assessment. Needs assessment as well as an asset mapping. What is available? What does the community need? But in times like this, when the situation demands very quick action, it's hard to do that very comprehensive needs analysis or asset mapping analysis. So what we'll recommend actually over here is working with communities that you might be familiar with, rather than taking a very reactive response, reading the news and going, oh, there's this group in need, oh, there's this group in need, what can I do? I don't know anything about them, but I want to do something. it's sometimes good to take a step back, to pause, and think about, hey, what are my assets? What am I familiar with? What is my group familiar with? Who are the communities that I've already been working with, that I have deep understanding of? So that really can shortcut the amount of time that's needed to understand, that can prevent misunderstanding, that can prevent us from doing things that might not really be what's needed, might not be what's useful. More importantly, it's also important that we don't just look at what the community needs, looking at them like people who are helpless, or having a savior complex, or we try and see and treat them as infants who are unable to help themselves. It's important to still maintain that view that these people are people with a lot of strength, a lot of assets. So moving from what we call what's wrong view to a what's strong view. And look at what are the networks, what are the equipment they have, what are the community spaces they have. Why is this important? Because when we start to look from an asset point of view, it actually reduces the time that's spent sourcing for a lot of the resources that we need. It reduces the underutilization of important resources that are already existing. And it also shortens the amount of time to prepare people to use these resources, because these are already resources and assets that we are familiar with, we know how to work with. So for example, if you were someone in the IT space, rather than going in and say, oh no, there's a lot of medical needs and let me try and help that. How about taking a step back and saying, how can my IT skills be of use in this situation, right? So that's moving from that needs perspective to also adopting an assets-based perspective. Another reason why it's important to look at the assets is because there are a lot of players coming in. When a situation happens like this, when COVID happens, a lot of people want to do something, and sometimes there might be duplication. So it's also important to see what's out there and ask yourself, how can I complement the efforts that are already there? Sometimes it could be as simple as just putting together information or reaching out to specific groups to let them know that, hey, this group is doing something, you can tap on them. It may not be reaching out to individuals. It may be asking, how can these other enablers, these businesses, these community partners, or even these government agencies who might have challenges, how can we help your efforts? So serving enablers rather than people directly, that can also be a direction when we start looking at what are the assets and what are these different enablers' needs as well. Very importantly, in times of COVID, we need to talk about the last point I have here, which is this idea sound? There's two levels of soundness. One, is it scientifically sound? So it's important for us not to just, based on assumptions or based on the WhatsApp University, for example, but to make sure that we check back with credible health sources, so WHO, MOH, to understand, is what we're trying to do sound? Because it can actually be harmful. So I think in the very early days, for example, you would see people trying to say, oh, okay, maybe I'll just use vodka instead of sanitizers because that's all I have. But does that really work? And would that actually lead to more harm if people are thinking, hey, I am well protected with my favorite vodka, for example? Yeah. The other part of working.
So sorry, actually, I just want to check real quick. Are you sharing your slides right now? Because I have I'm unable to see the slides on your end. Just checking if the share screen function has been turned on.
Okay, so sorry about this. Yeah, okay, let me check and see if my share screen function. I apologize for that. I think I might not have looked at them. Just give me 1 second.
No worries.
Thank you so much for stopping and
It's okay, because I have a copy of your slides here, and then I'm just kind of going through. I realized that you're very systematically going through some of the points in there. So I thought this was
yes. Is this shared now?
Yes.
Okay.
Okay, please proceed. So sorry about that.
Thank you so much for stopping me over there. I think I didn't click that button. Yeah. So I've covered the point on what to do. So the three main points: what are my community's needs? What are my community's assets? And is this idea actually sound? from a scientific view. It's also important to think about, is this idea sound from a real life perspective, whether or not it works? And I think this is a very important point for those of us who may be very technical or even scientists who are trying to communicate a lot of scientific advice or behavioral advice in ways that it could overwhelm the members of the community. So one of the very interesting things I learned at the beginning was, when we were trying to communicate what people should do, what precautions people should take, using hand sanitizers, being aware of distancing, physical distancing, there were members of the community who started to become very afraid and anxious, and they saw this as a panic reaction and started to say that, okay, I'm not going to do anything because I don't want to panic. I just want to stay calm. So I think this is something that we really need to think about, what is sound scientifically as well as behaviorally. So maybe I also want to share some of the work that we have done in Jurong. That's what MOHT has been doing in Jurong to illustrate these examples. So early on, when COVID first started and we realized that, hey, people, needed to stay at home a little bit more, the exercise classes in the community started to be cancelled. And we were working with this group called the Healthy Precinct Transformation Committee. So they were a volunteer group within Jurong, and they wanted to champion a healthy lifestyle. So for the last year that we were working with them, they were actively trying to look for ways to engage different segments of the community to get them to exercise more, to eat more healthy. And when COVID happened, they realized that, hey, these activities actually needed to stop. So a lot of community activities, a lot of exercise programs that were done for the elderly all had to stop. And we realized that, hey, people might be becoming more sedentary, people might be feeling very cooped up, and people might be very worried. So what could we actually do? So with that identification of their community's needs, because they were part of the community, they then realized that, hey, there were a lot of exercise equipment around the estates that HDB had built, that town council was maintaining, but were very underutilized. And at that time, because it was so underutilized, it was actually a safe facility where people could go downstairs and keep up their healthy lifestyle on their own. But when they realized that, hey, my fellow community members were very afraid to use it for two reasons. One, wow, this equipment looks so intimidating. I don't know how to use it, and I don't see my neighbors using it. I feel very awkward. People are looking at me. So they realized perhaps what they could do is to maybe create some videos, promotional videos with volunteers, with fellow residents to show, hey, this is how you can use it, and you're not the only one, but let's practice distancing. We can exercise on our own or with family members. So that's what they decided to do. And with that, they then asked the question, who can actually do it? So with that, I go into the next step, figuring out who can actually do these initiatives, who can take the community action that we're interested to do. The first point is actually usually the simplest, forming your team. People tend to group together when they have common interests, when they have experience working together, when they trust each other. So coming together as a team is usually the first step and the easiest step. But it's important not to just stop there. The other 4 different categories of people are equally important. So the next category, including community members and beneficiaries. It is very important that we don't just look at our own team, what can we do, but perhaps invite and constantly engage the people whom we're serving. And this is very important if we're serving beneficiaries whom we don't really consider as people that we interact with every day or people that we identify with, because we might not understand their needs well, we might not understand if what we're doing is appropriate. So it's important for us to also get them along in the journey so that we're not doing something to them or even for them, but doing something that's appropriate with them. And even better, if we can do it, if we can enable them to do it by themselves so that we can build the capacity within the community in a way that preserves the dignity of these people so that they don't feel like, oh, I'm helpless and I need help all the time. The next category, seeking advice from people who have tried. It's important that we also don't just go at it alone, but maybe try and find advice from people in the past who might have succeeded or might not have succeeded, so that we can increase our chances for success. It is also good, we realize, that we should invite experts, leaders, and authority figures to also join us very early in this conversation. One of the more common feedback that we sometimes hear from community organizers, especially those who might be new, is that, oh, I've tried to do this, I've tried to do that, but I realize I'm not allowed to do this, I'm not allowed to do that. When I talk to town council, they don't listen to me. When I talk to this person, they don't listen to me. When I talk to MOH, I didn't get a reply. Unfortunately, yes, we do have that sort of struggles, because sometimes these teams could be very busy and the process might be very different from what they're used to. So what I find very helpful, what we found very helpful in our community project in Jurong, is to actually engage all these different institutional authorities very early on in the conversation, so that as we plan together, we can do it in a way that they can best support. It doesn't have to be formal engagement. It can even be informal engagement. What do I mean by that? So for example, in reaching out to form your team, it is sometimes useful to include people who are volunteers, but who happen to work or happen to have worked experience with these different institutional authorities. And their advice can be very useful in terms of figuring out how to get things done, which is the right department to actually go to. As community leaders, some of you watching this may also be community leaders. It's very useful when community leaders step up, because community leaders are who people actually trust. And I think in Singapore's perspective, we did very well over there where religious communities were concerned. I think if we reflect back on the past few weeks, especially in the beginning where a lot of religious activities had to be cut back, it was very important that the religious leaders came out and said that this is something that we as a community need to do. We still can be good Christians, Muslim, Buddhists, if we can change our activities and do it in this way instead, rather than having the science experts and the health experts telling the community what to do. And the last group, or maybe not the last group, but the fifth group, and there might be more groups that I didn't think of, and do also suggest in the comments, are the resource providers. So one thing that we tend to do is, when we think about resource, we think about money, and we think about, oh, where can I get money from? Where can I get donations? And maybe I should have my Kickstarter project immediately. But in times of COVID, it's important that we partner with resource providers. So for example, mask makers, instead of saying, oh, can everybody donate a few boxes of masks, or can you give me just money? Because sometimes that delays the whole process. But connecting directly with the resource providers can smooth the whole entire chain a lot easier. So if I also wanted to share about our experience back in Jurong, what the volunteers actually realized is, hey, if I wanted to promote physical activity using the equipment, who can I actually tap on? And how would I know that I'm promoting it in the right way, in a safe way, I'm using the equipment correctly? With that, they got in touch with the builders, the people who installed, the company who actually installed all this equipment. And the company, PlayPoint, was very, very happy to actually be involved and support this whole, sponsor this whole initiative by providing their experts who were able to train these volunteers, to sponsor even the videos to teach people how to actually use this equipment. And that brings us, once you have gathered your team, that brings us into the how-to. So in the interest of time, I'm not going to be spending too much time to talk about the how-to, because there are a lot of available tools and resources out there. Resources that help people to decide what are the simple key actions that can be done, how do you create a platform where people can participate, or even the ways to partner and seek ways to raise awareness. I've listed some of these tools over here. So MOHT, that's the organization I'm from, we're developing an engagement tool to help people understand the needs of the community. SG United is a fantastic portal. It's a one-step portal for businesses, non-profits, individuals who want to do something, who wants to donate, who wants to find out more about what's out there. MOHT is a company I really liked what they have brought together to support social enterprises. So you can see over here that even private companies have a part to play. And tech platforms like Google for Nonprofits, they give a lot of very useful tech platforms, and even something like Google Sheets can actually be very, very useful. I think you've seen them around in putting information together. So these are the little how-tos that we can actually go and read more on our own. And again, going back to the first principles, finding about the assets, what are the assets that you have? Sometimes the tools that you're already familiar with would be the best tools because you know how to use them. So for example, in Jurong, they realized that, hey, there were a lot of social media platforms that they were already plugged into. There were a lot of WhatsApp groups where people, participants of existing activities were connected to, but because the activities were stopped, these became platforms where they could engage the community further in other activities that were now safer. The one point I wanted to highlight in terms of the how-to during times of COVID is how we can be safe. The first very important point is to please follow the health advisories. In helping people, let's not put our own health at risk, and we need to again constantly check back with the health bodies like the WHO, like MOH, about what are the current changes, because that can change very fast. What do we actually have to do? What kind of precautions we have to take? Another point is being aware of scams, because scams, there are a lot of opportunities who are taking this, this fear, making use of the fear, making use of the uncertainty, and sometimes even multiple players create, chaos and confusion. So they are taking advantage. We need to be aware of these scams, which is why also it's very good to go back to the trusted groups that we've been working with. That's a very important asset. If we have already established relationships with certain groups, certain communities, certain people, so that we know that these people are trustworthy. And third very important point, we need to constantly respect the people that we are serving, maintaining privacy, dignity and boundaries. Sometimes it's very easy to flout, for example, PDPA or ethical guidelines in our eagerness to actually help and call for help. And the last point that I wanted to talk about, figuring out when to stop. That's a very important point in situations like COVID, because things are very fast changing. It's important to constantly check back and communicate with community members, with beneficiaries. So one of the things we've realized is people tend to put out calls for help or start up initiatives. And when this information gets shared around, sometimes it can be outdated, and the groups have to manage the flood of volunteers way beyond the period of their needs. So a lot of times it might be important to, for example, date the publicity, provide contact information, and put up the information in a page that can be updated so that we can constantly update whoever is interested on the changing situation. It is also important to stop when there are better solutions or providers that are coming in. So for example, as first responders, we might be providing, say, maybe masks or sanitizers that are not really, the best standards. And that's sometimes important because the supply chain has not quite caught up yet. But once it does, that might be an important and appropriate time to step back and let the gold standard, the professionals come in. And finally, it's important to constantly check if there are unwanted side effects. And that's why it's also important to work with the community to get their feedback constantly, so that when things might, not be going so well, we would know it very quickly. So one example very early on is people were saying, oh, COVID is just like the flu, don't worry about it. It only affects old people. It only affects people who have existing chronic illness. But what people didn't quite realize was the impact that these messages had on people who were old or people who had chronic diseases. What kind of fear and anxiety does it build in them? And I think you can see that the messaging actually has changed into one where we need to care for these vulnerable populations. So it's important to get feedback and start changing. And of course, it's very important to always make sure that the idea is still scientifically sound. So coming back to our experience in Jurong, I think you can see where this is leading to. Even though in the beginning, they realized there was a need for people to continue exercising and continue getting fresh air. And they started to work on the video to start promoting through all the social media channels. Over the last week, people started to realize that, hey, wait a minute, with all the shops closed, with workplaces closed, people tended to congregate now in parks or at exercise facilities. And that was going to create a new risk. And we realized that, okay, perhaps we need to stop this, we need to pause this, because it's no longer a good idea to ask people to all come to your facilities around your neighborhood to exercise. So you can see that actually changes as the situation changes. I think I'd like to end on a note. Is it okay to not do anything? With a lot of news that's coming up about vulnerable populations, about people who need things, about anxiety, we tend to feel like, hey, we must do something. What can I do? What can I do? I feel useless. I feel guilty. I feel helpless. But maybe let's take a step back and say that, hey, you know what? It's actually okay to not do anything. You're okay as you are, because community action actually can take many forms. If you're a community leader, yes, you might be able to do a lot for the community that you're familiar with, that you're already looking after. But as individuals, or even sometimes as organizations, it's okay to just take a step back and say, okay, let's just stay home. That's all, that's good enough. And it's really about maintaining that friendship, that care. That's really the core of why we take community action. And all we have to do perhaps is just, SMS, WhatsApp, and check in with our friends to say, hey, you know what? I'm still here, you still have a friend, you're not alone. And stay home, that's the best thing you can do. Doing nothing, sometimes it really helps, just stay on your couch and do nothing. And that's fine, we are okay with that. And self-care is something that, we can do for ourselves, and that's also community action. And so with that, I'm going to stop over here and perhaps we can have a discussion.
All right. Thank you so much, Dr. Mathia. So that was a very timely discussion. It's very timely, especially so now, right? Because now we've got the new circuit breaker measures come in. There's even increased emphasis on safe distancing or physical distancing. I guess one question that I can start off with is, in these times, what do you think can communities do or focus on, while there are policies that say, we shouldn't be congregating, we shouldn't be having physical activities together if not from the same household. Have you seen any examples, or you can make any suggestions on what focus can be on at this point?
Yeah, I think that's a really good question to ask. And I'm actually going to take that question at a one level up, which means that rather than just give immediate advice, because I think that's something we actually have to be very wary against, seeing that there's a need and, okay, let's jump in, let's think of the 3 things we can do. Perhaps we need to take a step back. It's always important to take that step back. And maybe the first thing we can do is just check in first. Hey, migrant workers seem to have a need here. Elderly seem to have a need here. What can I do? And sometimes rather than asking ourselves or asking experts, what can I do? I would recommend the best thing to do would be reach out to these groups and ask them, how can I help you? Or if you have been helped, if you say, oh, yeah, this particular elderly or this particular friend or this particular migrant worker say, no, I'm fine. Perhaps the next question is, oh, what has helped you? And so in understanding what has helped all these groups that we're trying to work with, we can then think about, hey, maybe not everyone has this particular help. And then we can go and help them. So for example, and this is really just an example, it's not something we must do. We are starting to realize that, hey, the markets are very crowded and a lot of them might be elderly, and that's because they don't know how to use online grocery platforms. So they still have to go to the market, but we know that they a very vulnerable population, what's the best thing to do? Should we buy the food for them and then deliver it there? Should we go to the market ourselves? Or should we, what can we actually do? Sometimes they may be afraid. It might be as simple as them having groceries but not knowing how to use. It could also be things like, yeah, I'm going to buy groceries for them, and if I don't ask properly, I might end up buying Milo for them, biscuits and rice, and they might not want to, have Milo every day. They might not be able to cook rice for just 2 people every day. What do they actually need? So it's not advice that we can just dish out. I think the main thing is really to constantly ask and check that, is this appropriate? Is this still appropriate? Or if I bought for you last week, was that something you liked? Or is there something else I can help you with, and perhaps organize around there?
All right, thank you for your perspective. Actually, it ties very nicely back to your first point of what you can do, right? Because you identify the needs first, and then link up with assets as well. One other question that I have, because we've got some viewers and some friends from other countries as well, tuning in to the presentation. Do you think some of these principles would apply as well to, let's say, lower middle income countries, LMICs, where maybe there are also suburban urban differences or rural differences also? Does community participation for COVID-19 take place, has a role in these places as well?
I would say definitely yes. That's in fact something that's even more important. I think if we look at countries like India and a lot, I must caveat that I'm not an expert, because I've not myself worked with any of these other countries, but really just reading from the news, and we can see that sometimes when these countries try and just adopt wholesale measures, lockdown measures, for example, that the developed nations are taking, it might backfire, because the way society or work is set up over there is very different. So again, what are the local needs? If we ask people to stay at home and just take wholesale those advice, but we are talking about countries where there are communities where the home environment is actually not a safe one because it's overpopulated, or because people have to go out and work, or else they literally starve, that's something very dangerous. So I think community participation, understanding local needs, understanding what assets there are over there is even more important. Again, I think we need to be very careful about dishing out advice or even being judgmental to say that, hey, this country's not doing this, that country's not doing that. I think for us, that's the main thing that we have to be cautious against. And for workers over there, or people trying to work in these countries, really that fundamental principles still stand. Rather than seeing the aid organization as a savior, asking the community what works for you, what has worked for you, what can you do, what would you like to do, where are the resources that you might need. And again, instead of just throwing money, it might be then finding other community partners within that same community that they can connect with, because that would be something sustainable. It's not quite sustainable to keep on just pumping in donations.
All right, thank you. So maybe I'll just take 2 more questions for this webinar. One question came up. Now we're focusing a lot on safe distancing. We're focusing a lot on slowing the spread. But then at some point, we hope this ends really soon. Do you think that community has a role to play towards that stage of the pandemic ending? Do we have some focus at that point in time, apart from stopping the spread, which is the focus now?
Yeah, certainly. I think the role that community plays is actually very important. If we go back to what can work, the single message I think that a lot of countries are championing right now, especially Singapore, is to stay at home. It's easy to say stay at home. We think it's easy to stay at home because when we're busy working, that's all we want to do. We want to stay at home, right? But when we finally have to stay at home, we realize how difficult it really is. And I think perhaps that one thing that our community can do together is to reach out to people because how you convince your parents to stay at home is very different from maybe how you convince your neighbors to stay at home. Very different from how you convince your fellow young cousin who likes partying to stay at home, who thinks they are invincible to stay at home. Different groups need to be convinced differently. There are some needs that they might have. So for example, I think over the last few days, we also realized that Grab delivery personnel, for example, can't really stay at home. They have to continue working and they have nowhere to eat. So what can they actually do? These are little things that, you know, it's very hard to wait for MOH or wait for a government agency to come in and say, okay, this is the way we do it. We really need community to step up and convince each other, tailor the message, because you can't, again, have MOH having 100 different messages for 100 different target audience. It's really up to us to convince the persons that we know. And because we know them best, we know their psychology the best. We have, you know, we have been living with them, some of them, for so long. We know what works. That individual personalization requires the community. Even community leaders, you know, when the government says this, it may not be as relevant as when my religious leader says this, or when my father says this, or when, you know, people I know, my friends, my best friend, the coolest kid in class says this. Who actually says it is very important. So yes, community. In fact, I would say if you are an enabling agency or an enabling a resource provider, it's very important that sometimes we work with the community respected leaders, the natural leaders, may not be formal leaders, to be the spokesperson for the messages that you're trying to actually drive through.
All right, thank you. And that's a very important point, you know, like community can be defined along many different lines, can be just within your family, can be along religious lines, can be along geographic or, you know, like your lived environment kind of lines, right, which, you know. So I think that's a very important point for our viewers. I think one last point is that, you know, now we're living in a social media era, you know, and I think that has really flattened a lot of ways in which we access resources, you know, in which we articulate needs, you know. So it has kind of like made that a lot more equal. Both in good or bad ways, because there's also the fake news on one end of the spectrum, right? You know, how can we actually use it in more immediate ways, right? Or have you seen any virtual communities come up, you know, to really, really help to deal with, you know, I guess thriving in the COVID-19 pandemic here?
Yeah, I think social media has taken on a way more important role right now since people cannot actually meet, and there are so many groups I think that have popped up over the last few days. I think just, you know, a quick Googling, sometimes you would find it, but more importantly, I think if you look at what your friends are joining, perhaps those would be more relevant to your interest. So there are a lot of these groups. Again, there are a lot of, say, even Google Sheets coming up. Spreadsheets coming up just to put together resources and needs. And I think this is where it's very useful because it collates information in a very timely way. It can be updated in a very timely way and corrected as well. So when you talk about fake news, it can be corrected as well. Again, the community can play an active role at correcting it. But I think that also brings us to some of the precautions that we need to take. You know, just making sure that these are sound as we respond, making sure that perhaps these are dated so that we know when to start, when to stop, making sure that we preserve privacy, because I think over the last few days in some of these spreadsheets, we do also see that perhaps personal information that you know should not have been shared sometimes is shared. So these are precautions that we can take. Yeah, as you know, we pay attention to this. I think fake news is a very interesting thing, and a lot of people, you know, are very worried about it. But perhaps this is also where, again, community can really step up. If we wait for WHO to come up with a response, you notice that it can be 2 weeks too late. Again, it depends on us to fact check. We tend to trust our immediate echo chambers a lot, but by reaching out to other groups, so for example, my echo chamber could be very different from my parents, and both of us could exchange very different views from our echo chambers. And in that sense, we begin to understand what might be scientifically sound, but also how it might be perceived and what can realistically be done. So it's a both-way thing. It's not just about science, but by understanding all the different communities.
All right. So actually, I think that's all the time that we have for today. You know, thank you so much, Dr. Mathia, for your time.
Thank you so much.
And very, very wonderful insights. Actually, a lot of these, I believe, are all very evidence-based, very theory-based as well. You know, but the way that you presented was, you know, very, very, very exciting for our viewers. You know, I think, you know, would you be okay if our viewers or anyone else who's watching the videos maybe email the society and then we pass these questions along to you?
I think that'll be awesome. And I think maybe I'll just do a plug over here. So at the MOH Office for Healthcare Transformation, we are working on what we call movements for health. So before COVID came up, I think it was very much healthy living centered. How do you work with communities to get them to adopt healthy behavior? But I think because the same principles apply, it'll be very interesting to also work with community groups to explore how it can be used in times of COVID as well, especially if it's gonna, we don't know how long it'll drag on for. So yeah.
All right, thank you. So now my turn to do a plug. You know, for the Society of Behavioural Singapore, if you're interested in more of our updates or upcoming maybe webinars at this point in time, you can join us as a member. You can go to sgbehavioralhealth.org. You can view all the past webinars there. You can sign up as a member. We've got a quarterly newsletter. We've also got a Facebook group that you can join for updates as well. These will allow you access to maybe future discounts for workshops on behavioral health. And what we're trying to do is interdisciplinary. We've got members in the Exco who are from nursing, psychology, sociology, people who are mindfulness practitioners. So we're trying to gather a whole society of members who are passionate about behavioral health. And Dr. Mathia is actually one of the members also, and she's been very integral to the initial support of the society as well back when we first started. So I think if you want to find out more, do join us on these platforms. But if not, thanks, Dr. Mathia, again. We will see all of you around. Thank you.